when the diagnosis of autism is made, the only thing that people are told is the only evidence-based therapy that we have at this point in time is ABA therapy. That's called applied behavioral analysis. And it's essentially repetitious, very controlled, reward-driven, structured education. And I've seen reports from premier children's hospitals here in the Houston area and from the country and around the world that diet has nothing to do with this, environment, toxins have nothing to do with this. But this was known in 1989 when vaccine regulation legislation was signed. And it's so sad because it's damaged a whole multiple generations now of children.
Welcome to Vitality Made Simple. The following production is for educational and entertainment purposes only. If you need medical advice, call your doctor. Now, let's go to Vitality Made Simple.
Welcome to Vitality Made Simple. This is the podcast that equips you to feel better, look better, and to enjoy better relationships. Now, if you're someone who believes that children are our future and that the health and vitality of our children is key for any society, then this podcast is for you. I want to welcome Dr. Paula Kruppstadt. Welcome, Paula.
Thank you for having me. I'm really excited about this.
Well, it's a thrill. Paula and I met at a medical conference. We were both speakers. And then we had a refreshing dinner together and just talked about our journeys. Paula graduated from medical school in 1990 and was classically trained as a pediatrician. Now, her own journey has only emboldened her to help more people. So, Paula, tell us about your own health journey and how that led you as a pediatrician into functional medicine.
Yes. Well, when I graduated from medical school in 1990, I was the first person in my family to ever become a doctor, one of the few to graduate from college. And my father had joined the Air Force when he was 18 years old. And my parents didn't have the resources to fund my education. So I ended up taking a military scholarship and I was an Army pediatrician. I met my husband in the military. He was in the First Persian Gulf War and I was classically trained as a pediatrician. I knew from the time I was in second grade that I wanted to do something in the world. And then by eighth grade, I knew I loved children. So as the oldest of four, I went to med school in Texas, served the military in Texas, and got out of the military in Texas. But very early on, I had this shift, and I began struggling with depression and addiction, and I ate my way up to 300 pounds. And through the years, I struggled and took probably 11 to 13 different antidepressants, but it didn't really deal with the root cause of why this was happening. So several years ago, probably I began biohacking and looking for all kinds of things. I mean, I've done every diet under the sun. I went to the Daniel Amen clinics. I did Jenny Craig. I did this food plan, etc. But I invested in precision genetics, and that's what transformed my life. I found out that I had, and at this point you'd go, well, duh, it's obvious, but we're not taught these things in medical school or dental school in this way through the lens that mental health problems are a manifestation of, number one, inflammation. You know, if your brain is hot, red, swollen, and painful, and you can't unzip it and go, my brain is hot, red, swollen, and painful, it shows up as sadness, as anxiety, as fear. And when we translate that to children, it's global meltdowns, it's temper tantrums that are not commensurate with what you ask them to do. Susie, go get your coat. We're going to go see grandma. And they throw themselves down on the floor and cry. So inflammation, number one, and methylation. Methylation is a process where we incorporate vitamin B9 into our cells. And at the root of depression is inflammation and methylation. So when I found that out, it changed my life. In my desperation at age 36 with 2 children, and I wanted to have more, I had a gastric bypass, a permanent Roux-en-Y gastric bypass. And I really believed that that tool saved my life, but I didn't know all the micronutrient deficiencies that would happen by changing my gut. So anyway, hindsight 2020, all these years later, I found functional medicine about 11 years ago, became certified through the Institute for Functional Medicine, left my general pediatric practice working with Baylor College of Medicine, Texas Children's Hospital, Texas Children's Urgent Care, and opened my own practice. And I'm so grateful because we have had the opportunity to partner with parents whose children are on the autism spectrum, who have complex medical problems. We also treat children through adults. We have a medical team of 7 medical providers and a genomics, nutrigenomics interpreting team. And we just love what we do. And we are seeing beautiful things happen. Children talk, children lose the diagnosis of autism that had been given absolutely no hope. And my journey, which was a lot of shame and self-deprecation, has been transformed to one that looks at life as, what can we learn from this? How can we spin this? How can we look at what's possible, not what's impossible? And so our practice is called Hope for Healing, and we want to give people hope. And that's what we do.
If you have brain fog, bloating, or bathroom problems, check out Dr. Debbie Ozment's online course called Upstream Gut Health. Simply go to drdebbieozment.com. That's DRDEBBIEOZMENT.com and visit the Courses tab. Priced at less than an office visit, this course can help you feel better, look better, and enjoy better relationships.
I was so excited to meet you. At the time we met, we were expecting our first grandchild. She's now born and 8 weeks old. And, of course, that just makes you very interested in the health of the children. I'm reminded of the Maasai tribe. When these violent warriors meet each other, they have a saying that basically says, well, how are the children? Because they know that's what's happening with the children is key to their society. And it's never been more key, Paula, than it is now. You've been doing so much under the radar that now is very open in our news with RFK, speaking out against maybe vaccine injury. So you've been seeing a lot of changes in children over, 35 years of treating children. And I want you to tell our listeners about what you've seen and how you've pivoted what you've done to meet those changes, say the increasing rate of autism, the increasing rate of ADHD, just a lot more illnesses in children. And folks, one thing that I'm so impressed with Dr. Paula is that she sees people of all ages. This is about relationships. This is families. It's not like we can silo medical care any longer in any way. And as a side note, Paula, I want to just tell our listeners, if you're watching this on YouTube, the background changed for Paula because she's got these doggies that she loves and they wanted to come say hi. So she had to kind of move to a different background. So you're not seeing things if you think you are. So, okay. So tell us, what you started seeing and how you had to, tiptoe around it with maybe having a little different vaccine schedule. And then just what you see for the future, the positivity that you see.
Yes. Well, when I graduated from medical school, first of all, I love how you frame that. We have seen some huge shifts. And just as a side note, well, it's not a side note, the genetics of children that are not neurotypical, autism, ADD, ADHD, all these labels, ODD, oppositional defiant disorder, brain inflammation, something called PANS, is almost identical to that of adults with neurodegeneration. But the issue is that the clinical findings are showing up in catastrophic amounts in our children. And as you said, I hadn't heard that before. How are the children with the Maasai tribe? So in 1990, the rates of autism were about 1 in 10,000. And now in some states, for example, I think in California, it's 1 in 28. I believe the most recent statistics are 1 in 32. The genetics have not changed. The toxicity of our environment has changed. And if we look at, okay, I was born in the early 60s. What happened in my generation was we had plastic, we had herbicides, pesticides, melamine, Tupperware, and disposable diapers, and we've moved all the way over back to glass, stainless steel, and removal of a lot of these toxins from the environment. And we know that Europe is ahead of the ball game. You know, when you look at the toxic things applied to our bodies, 11 are only inhibited or stopped in the U.S. versus 1,300 things for things we apply. But we began vaccinating children, and when I was vaccinated, it was 8 to 12 vaccines in the years 0 to 18. But now, if you give a child the flu vaccine, you can be upward of 80 to 82 vaccines between 0 to 18 years of age. Additionally, why are we giving a hepatitis B vaccine that has 10 times the amount of aluminum that you would give at 1 to 3 days of age if the parents are not hepatitis B positive or IV drug abusers? There's no reason for that. It's strictly money and pharmaceutical driven. So I saw, and I used to be what I call a vaccine Nazi, because I went to Africa as a medical student and I saw children and adults die from vaccine preventable illnesses. But the difference between a third world country and the United States is we have access to clean water and, soap and water to clean our wounds. So many people think that by administering certain vaccinations is what stopped certain diseases from developing. Well, in actuality, it was improvement in our public health system. So the most common chronic illness in children is asthma. But in recent years, love your coffee cup, you rock. We have discovered that there's actually an entity that's more common than that. The genetic vulnerability is present in 1 to 8, and it's called chronic inflammatory response syndrome. It has to do with biotoxin illness, mold, bacteria, venoms. Algae produces biotoxins that can initiate a cascade of inflammation. So now what we're seeing is pediatricians who are aware of what's going on in the toxic soup of our world, is that our job is to minimize the amount of toxins that go in and onto and are around our children and our grandchildren and ourselves, to stop neurodegeneration and to stop cancer. And that's kind of the landscape, which is really, really sad.
That is so essential for us to all face, that our world is very, very different. I'm a little older than you. I was born in 58. And, nobody had these problems. I mean, I don't remember anybody having these problems, Paula. So what do you do differently at Hope for Healing to not only mitigate people who have already been impacted, but also to help people prevent? I want to say that I've been beyond impressed with our daughter and son-in-law in what they've done for their daughter. The awareness is so impressive among young people, and we want to even raise that more with what your experience has been.
Well, what I love is as parents, as new parents and families, the power that they have in their kitchen. So I'm sure that, you've talked about this ad nauseum, but the website and there's a mobile app, environmentalworkinggroup.org. There's an app you can scan and use in the grocery store. And when you're feeding your family, it's financially impossible to feed everything organic, but not everything has to be organic. So the power in the kitchen, number one, is to reduce toxins and inflammatory entities. So unfortunately, here in the United States, everything and around the world is impacted by glyphosate. Glyphosate is Roundup. We're all aware of the Monsanto lawsuits, all of those things, but that has a profound balance. So first of all, the dirty dozen, avoid eating those foods, have them be organic. Everything else, the clean 15, you can get and not buy organic, and the principles. So that right there. The other is we give milk to infants. The only dairy product that human beings are meant to have is mother's milk. And when you grow, you need wheat or other things. And I was going to say that we as human beings are not meant to ingest. We're not baby cows, sheep, or goats, okay? Cows have 4 compartments to their stomachs. We don't have the enzymes that cattle do. But the thing about, when we think about the epidemic of neurodevelopmental challenges, gliadin, which comes from gluten, or anything that's what we call gluten cross-reactive, and casein, which is a protein contained in sheep, goat, or cow's milk, dairy, or cheese. Those casomorphin, those molecules are very, very addictive, and they bind to folate receptors. And folate receptors are what we need for our brain and body to receive dopamine production appropriately and to balance our neurotransmitters. And so we're seeing this huge uptick in tongue and lip ties. And as a dentist, you're probably aware of that. In 1991, the American Academy of Obstetrics and Gynecology required folate to be added to vitamins. So, but folate, synthetic folate, blocks folate receptors, and we need bioavailable folate, methylfolate instead. So we've had this population of infants born with what we call neural tube defects, midline issues, and this explosion of tongue and lip ties. And I was one of them myself, didn't know, and now I'm Invisalign at 61, But so my message to parents of what they can do to decrease inflammation in their babies, and this goes for mommies too, because we don't have access to clean grains here in the U.S. It's inflammatory. So I would just say eliminate gluten-containing grains like barley, rye, oats, wheat, spelt, gluten cross-reactive, corn, rice, millet, and dairy and yeast, and eliminate cow's milk dairy, not only for mama that may be nursing her infant, but also for children and families, because our supply is so bad here in the U.S. And if you have the genetic vulnerability to develop, celiac disease, then by all means avoid it altogether. So Dr. Alessio Fasano, who discovered this. He's from Italy, for Pete's sake, and he said, well, gluten makes your gut leaky for 3 to 4 hours, so yes, I've stopped eating it too. So
Dr. Fasano was on the podcast. I don't know, 2, 3 months ago. He is fascinating for our listeners. He discovered zonulin, which is the protein that is the biomarker for leaky gut. Yeah, super, super great. So Paula, tell us what testing can be done for people and what you do in your clinic to help people know what their own genetic vulnerabilities are.
right. So we can see patients internationally, well, not patients, internationally, our health coaches and our genomic team can see people to review their genetics. But if they want to become a patient, they have to come to Texas. But I personally have a Florida telemedicine license also, but all of our other providers are here in Texas. So what we do that sets us apart is we have parents who come to us and say, my 5-year-old is autistic, and we saw this change around 15 to 18 months when we introduced a partial live virus into their body, or we saw a change at 2 months when they received their first vaccines. Everybody's different. You can't say that vaccines are responsible for autism or else we'd all be autistic. It's the genetic vulnerability, the toxic soup, and the introduction and the external environment and external toxins too. So what we do differently is a cheek swab. It's a proprietary panel that a company allowed me to select and put together, and we call it the Hope for Healing Wellness Blueprint. I also have one called the Newborn Panel, but the Newborn Panel is for everyone, but the blueprint is everything. And it's all ways to modify how your genetics show up in your life. So if I had had the benefit as a child or a young adult or as a medical student, I thought it was normal to cry every day in med school. I didn't know.
Oh.
I was like, okay, I just have to cry, get through it, and do my work instead of having biochemistry that was balanced. So when I found out what I needed, I was able to give myself what I needed, take away what I didn't need or what was causing damage in my own body. And it's everything from inflammatory pathways, your vulnerability to develop type 2 diabetes, or if you're one of those hangry people. Autophagy identifies how our cells clean themselves out, and then our detoxification systems, how we absorb B vitamins, how our mitochondria are powered, our hormones, and also our vitamin and mineral receptors. So we can identify from as young as 2 days of life, if a pair comes in and lets us do a little cheek swab, or we can put it in the mail. And then you have this beautiful roadmap, this blueprint to be proactive, to identify vulnerabilities and protect your child, give them what they need, and don't give them what they don't need. So you don't have to guess. And that's the beautiful thing. And that's what sets us apart. We also have coaches who join families on this journey because it's so hard when you have 4 kids, both mom and dad work. How are we going to make this food? How can we make this work? And we work with families. We give them meal plans. You can do this in 2.5 hours on a Saturday morning, and we're going to help you. And we want to give them boots on the ground, tangible help. And that's what we do.
Well, and I think you're providing so much excellent awareness. It's so easy to, at least for me, when our children were little, to just be thinking about what the next thing was or how to go to the park and have fun. And I just wasn't aware of toxins, of toxic load. And of course, that's 34 years ago. But nevertheless, looking back, I was like, wow, I was sort of brain dead in some ways. I just didn't even think about, Velveeta cheese. How can Velveeta cheese be in the pantry? and be okay. You know what I'm saying? I mean, I think this just awareness that I'm seeing among young families is so exciting, because it's logical. So many things are logical. So, Paula, I would love to hear about, and for our listeners to hear about, some of the miracle stories you've seen in your practice, because we have children and we want their little quivers in our arrows, like it says in, like, what, Psalms 127 or whatever. But it we want them to be able to launch. We want them to be able to fulfill their God-given purpose. We want them to feel good. So the frustration I've seen among people who go, "Oh my gosh, Debbie, they were different. They were fine, and then now they're different." So what have you, when these people come to you, what have you seen change? I want our listeners to have so much hope.
Yeah, that's the thing. Because when we look at what's going on in the world, it can just drag you down and you can be so discouraged. When you have a child that's 9 years old and they're still in diapers and you're changing poop, and when they can't speak, what do you want for your child? You want them, and this is what I tell new parents, when they're not around, when the diagnosis of autism is made, the only thing that people are told is the only evidence-based therapy that we have at this point in time is ABA therapy. That's called applied behavioral analysis. And it's essentially repetitious, very controlled, reward-driven, structured education. And I've seen reports from premier children's hospitals here in the Houston area and from the country and around the world that diet has nothing to do with this, environment, toxins have nothing to do with this. But this was known in 1989 when vaccine regulation legislation was signed. And it's so sad because it's damaged multiple generations now of children. So let me give you some hope. So I try to tell people, I want your child to be able to verbalize, if at all possible, or to be able to communicate, to set up boundaries, to say what they need, what they want, and to potentially graduate, have a job, lose the label of autism. That's apart from other genetic syndromes or other reasons why they may be autistic. So that may not be possible for every child, but functional medicine, healthy environmental medicine always imparts hope and health. And the body, as we know, is meant to heal. We are fearfully and wonderfully made. So let me give you one of my favorites, and then I'll give you two from just the last week and a half. Well, one. I have a little guy that I've been seeing since November of 2024. He was in the office with his parents last week, and it was after they picked him up from ABA therapy. It was late in the afternoon, and he was done. He needed to go home. He's only partially verbal. They began their journey less than 6 months ago. He's 5 now, just turned 5. In the appointment, when it was time to go, and I had said, "All right, we're done. You get to go bye-bye." He picked up his shoes and started to put them on, and his parents looked at me and said, "That's the first time in his life he's ever put his shoes on." Okay, so that's one. And then yesterday, I was talking with a family that they're so motivated. Their little girl is 4 years old. They live in the greater Houston area. They began one supplement after reviewing their precision genetics. We have them start that, get on the roadmap, get into established medical care. They gave her one supplement that we use to modulate a system in the brain and the gut that lowers something called cytokines that are produced by microglial cells in our central nervous system, and also by the Kupffer cells in our liver. They line the vagus nerve. So we've seen these kids, they're in fight, flight, freeze, or fear. They're scared. It's like they're hypervigilant. Their pupils are dilated. They gave her one supplement based upon her precision genetics. Now, you got to understand, there's multiple holes in the dam of inflammation. Can't plug one dam and expect one hole and expect the water to stop coming out. Her speech immediately improved within about 3 weeks of trying that new supplement. They said it was immediate. So those are the two recent ones. And now I met a little girl 7 years ago who had been diagnosed with autism at the age of 2. She moved into a home with her family, her mom and dad, had no other siblings. Mom's an attorney. Dad is former military. And she stopped talking and regressed. So she'd been labeled and diagnosed with autism at a premier children's hospital here in Houston.
So can I interject? So she was talking prior to moving into that home. This is going to be a great story, folks. And how old was she? Okay, so she was jabbering and telling him, what to do. And okay,
They have videos, pictures to good eye contact. Moved into that home, lost speech. She was labeled with selective mutism and autism. Came to our practice. We did the precision genetics. I recommended several things at that time. And the mom and the dad right now will say we weren't bought in. We weren't bought in. We lost them to follow up. And prior to presenting to the clinic, she'd had multiple ear infections, been on multiple antibiotics. Her immune system had been on fire. It obviously wasn't functioning well. But see, that's our society's normal.
Right.
People say it's normal to have eczema. It's normal to have multiple ear infections. It's normal to have asthma. Kids in our practice that do this from birth up, they're the healthiest children I've seen in my entire 35 year of pediatrics. Okay. If the parents engage and dive in, it's beautiful. Anyway, so long story short, it took 4 years for this family to test their home for mold. And the mom told me, she said, Dr. K, if you had not been in my face, let alone kindly and respectively, like a dog with a bone, and had not said, test your home for mold, we'd still be there and my daughter would still be considered autistic. She's 9 years old now. She's mainstreamed in a local public school, and her mom being her advocate and her dad, they pushed and said, we want you to officially test her again. And they said, she's not autistic. And the mom's second guessing herself. I said, no. She met the check marks for every system to be labeled as autistic. So the story is they lived in that home for 4 years. The dad in his late 30s, he developed atrophy on a brain scan. The mom developed elevated liver enzymes, and the younger sister had multiple ear infections and required ear surgery, who was born during that time. So they came back, they're fully invested, and she was diagnosed with chronic inflammatory response syndrome, biotoxin illness, and their home was so sick. And we have a label for that, contact with toxic mold. It's an ICD-10 code. That little girl met the clinical criteria for PANS and autism, and they moved out. And within a year, she began talking. She remembered being at the pediatric neurologist the year before she was speaking, and said, I remember when the birds were hitting the window. In Texas, cardinals run into glass all the time. And that little girl remembered everything. So our thing is, that mind is so beautiful. I never speak anything but life-giving words in front of children. So I want to encourage parents the same thing. Don't go to the doctor and talk about your child who's sitting there with you like they can't hear you. They hear everything. We have to think of what's possible and not speak words that aren't life-giving to and around our children. So that right there, and she's published that. In fact, you might want to interview her. It's called Conscious healthy home. The mom, and she broadcasts it, it's Christina Greenfield. She's here in Houston. And I love that family, and that just blesses my heart. And we have other children on this journey. We have adult children with autism. People give up on teenage boys, and you can move the needle. You can. So
Thank you for bringing this out, Paula, because I think it's so key. I interviewed Dr. Thomas Lodi probably, I don't know, a year and a half ago. Great interview. But we talked about um, the power of those words. He talked about not taking the curse of a diagnosis. And it was so powerful. So I literally make my patients stand in front of the mirror because my practice is limited to mostly physician referrals of people with chronic inflammatory illnesses, everything from cancer to memory loss, you name it. But someone will come in and say, well, I'm a diabetic, or I'm a cancer patient, or I'm an Alzheimer's. No, I make them stand in front of the mirror and say, I am a child of the living God. My body is designed to heal. God will help me find what my body needs, just like you did, with your testing. And it's so powerful. These words are so powerful. And then there's been, all of these great studies about just, the vibrational, the quantum physics of sound waves, and just speaking words of life. And of course, that's totally biblical too. This day, choose life. Don't choose curses, choose life. And I think there's so much we have to learn. And one thing I so appreciated about you when I met you was your curiosity, because there's still so much to learn. And for people to every day speak words of life, not only to each other, but to themselves. And that is healing in our bodies. And I hear people speak these things over their children. Oh, he throws tantrums or whatever. It's like, no, speak good words. He is getting stronger every day and learning more every day. And whatever it is, because like you said, it's all registering with kids. I mean, you've seen that better than anybody as a pediatrician for 35 years.
I love what you said that you do with your patients, and I think I'm going to adopt something similar to that. I've adopted, speaking words of life, but looking yourself in the mirror. I think back to my dad. My mom and my dad believed in me, and there's always a balance, but believing for me what his generation did not believe for him, and breaking those generational curses. What you said, I wanted to kind of piggyback on that. At that conference where we met each other, and I kind of said, you're kind of like a sister from another mister. Our husbands even felt a little bit of a camaraderie, but also the stage of life that we're in, seeing our children have children, and our generation, just the toxicity. But you're right. And kids heal so fast. They're so resilient. And the needle can move exponentially because of the neuroplasticity of a child's brain and body. And like you said, we are fearfully and wonderfully made. And I too believe in the life-giving words of Scripture. And as a man or woman thinketh in his heart, so is he. So if we're using those negative tape-playing words, I'll even ask kids as I'm trying to determine if they fit the diagnostic criteria for pediatric acute onset neuropsychiatric syndrome or autoimmune attack on their brain due to strep. Do you tell yourself, do you feel like you tell these words to yourself like, I'm bad, God doesn't love me, my family might die, and they'll go, yes. And their parents will look at them like they had no idea because they're afraid to verbalize those ugly, dark thoughts. And then I say, okay, what I want you to know is those things are not true, are not necessarily true. Bad things can happen. But when you hear those things, it's okay to say, Mom and Dad, I'm having this fear. And then that's when you need to sit and the power of breathing. And when we talk about gratitude, studies have proven that you release endorphins and interleukins and lower pro-inflammatory cytokines when you tell yourself those things. So what you said about cancer and Alzheimer's and chronic inflammatory issues, you're right. You are not your disease. I'm a woman, I'm a mom, I'm a child of God, and I love myself of who I am inside. Maybe not what I've done to my outside, but I want to get on a path to move forward instead of limiting ourselves. When I think again about children and things like that, this is piggybacking off. We think about our brain. So there's a system called the glymphatic system. And for babies on up, you know those sliders from Home Depot that are about, a quarter of an inch thick? Parents can take those little sliders and put them at the head of the crib so that even their baby in the crib can be elevated slightly by gravity. So when they sleep, the glymphatic system of the brain is draining crap by gravity out of their brain. So that's a baby hack.
That's a good baby hack, Dr. Love it.
Yeah. Also, something we do different, and we actually did like a little retrospective study in our own practice. One of the things that is the American Academy of Pediatrics recommends is a complete blood count at a year of age. As you start transitioning, you start on solid food around 6-7 months of age, and you transition eventually off of human breast milk and onto, I recommend water and maybe coconut milk, and we check iron, but we check vitamin D25 hydroxy at 1 year of age. And we start with 1,000 international units of D3 plus K2 at birth. And we recommend that parents give 1 drop every other day to their baby until they're 4 months of age. And then when they're 4 months, they go to 1 drop a day. And in all these years of testing children, I've only had maybe, a handful of kids greater than 100.
Okay, so to backtrack, do you start at 2 months, you said?
1 day of life.
1 day of life, okay.
Yeah, so when parents bring their baby in, if they're born at the hospital or birth center or home delivery, we recommend that they start with 1,000 international units of D3 plus K2 every other day. Then at 4 months of age, go to 1 drop. And currently, the recommendations are 400 IU of just D. But we know nutritionally that you have to combine vitamin K2 with D3 to absorb calcium from the gut. Vitamin D is not really a vitamin. It's a corticosteroid, and it modulates the immune system. And we recommend when kids are sick that you double it for 5 to 7 days. I saw a 6-month-old yesterday had been diagnosed with COVID at urgent care. She's smiling at me. Her fever had started to go down. And I told her mom, so just double it for 5 days, go back down. And we had the mom who's breastfeeding go into our IV room and get an immunity drip with high dose, vitamin C and then that way her breast milk has this high antioxidant capacity. Mom shouldn't get sick, and the baby's going to do better too. So,
oh, that's great. How soon does that vitamin C get into the breast milk?
That's a great question. I do not know, but I bet it's within, if it's given IV, I bet within an hour or so.
Mm-hmm.
Vitamin C is used up every 4 hours in our body. So when we get sick, taking it orally every 4 hours, but we have different forms of vitamin C we even recommend for children that parents start pretty young, especially if they go to daycare or Mother's Day out, church nursery, whatever, probably around 6 months of age, liposomal, or even There's a perk form that's really good too that can go in water, but if mama's getting it, I bet within an hour, but I would have to check.
Well, that would be a pretty good hack, Dr. Paula, to if you're going to a wedding, a get together, and maybe for the mom to take that day some liposomal vitamin C. I've interviewed Dr. Thomas Levy several times, and we've talked a lot about the amazing impact vitamin C makes. And I appreciate that you brought up vitamin D. Vitamin D is really what started my functional interest probably 25 years ago. I had a patient who she was a judge, and she was very regimented. She came in, sat in the same chair in the reception area, same time every 3 months. But she did everything perfectly that I told her to do, but her gums never looked healthy. And I mean, this is 25 years ago, and she'd been my patient at that point for 15 years from day one. Anyway, she comes in and she looks great. I mean, her gums look totally vibrant and healthy. And I'm like, what are you doing differently? And she said, nothing. I'm doing what you tell me. And I said, no, you're doing something different. What are you eating differently? What are you? What are you? And so she's like, no, we couldn't uncover it. And I said, well, when you think of it, come back in, call me. And of course, this is before cell phones, Paula. So she leaves. I was in an office where we had big windows. We see her coming back in, and I said, oh, she thought of it. She comes in and she said, well, I've been getting a vitamin D and taking a big vitamin D tablet, a prescription vitamin D. Could that make a difference? And I said, I don't know. I mean, this is the year 2000-ish. And so I start researching, and oh my goodness, that just opened such a bright light when you think about, vitamin D being the sunshine vitamin. And so thanks for bringing that up with babies. I just did not know that. But if the mom is deplete, which everybody that's ever been tested that's not intentionally taking vitamin D is probably low. The minimum requirement is it still 30? They may be saying 40, but it's still too low. You want it up 90.
Yeah. We're like 60 to 80, but I mean, 60 to 100, but I tell people aim for 80, 90. That's great. And we know that, apoptosis of carcinogenic cells, if you optimize it 90 to 100, it's great. Debbie, may I ask you as a dentist, because we'll let our practice know about this, but what would you recommend for parents for good dental oral microbiome health for their infants and their toddlers?
I would say to avoid fluoride. I would say to, of course, minimize these high fructose drinks. I think your patients and anybody that's ever seen me knows that, but still, it's so key. This is one thing I want to talk to you about, because one of the big challenges I see among people is they're wanting to protect their children from a lot of toxins, but then they go to the grandparents' house and the grandparents are like, well, they're here, I can do what I want to. And it's a lot of things they don't need. Maybe it's suckers and, these rewards that are pure sugar. So I would say real food. I would say, the biggest thing you want to avoid is any antimicrobials. Even a lot of people will have their little kids swishing with, it sounds crazy, but with, mouthwashes that are killing everything. I interviewed Dr. Nathan Bryan a few months ago. We talked about nitric oxide, and so he's just incredible. And people are killing the good bacteria in their mouth, and therefore those good bacteria designed to do all kinds of things that we don't even know about yet. So I don't know if I've answered your question. They get their first teeth, at about 6 months, these little front ones, and then by 2.5 ish, they have their baby teeth. So those baby teeth matter. They're space holders, they're part of airway development. I would say, Paula, it's important to start introducing some hard foods when appropriate. You would know more about that, but that helps develop their airway. Um, they can't just be eating these packets of goo squirting into their mouth. They've got to chew. God gave us teeth to chew, and that helps open their airway, which helps them breathe through their nose. I would say that's a real key for. I know you see that all the time. Talk about airway. The dentist that I office with, she is incredible with airway, and kids' behavior changes a lot when they just start getting good sleep. So many facets.
I love that. Yes, I wanted to hear from you. Fortunately, we have the blessing of working with some phenomenal pediatric
Mm.
dentists. And, we identify these tongue, lip, buccal
Mhm.
ties very early on, and they get the fascia, the oromyofascial therapy. And you're so right. I mean, these babies that posture to open their airway when they sleep because of all these tethered tissues. And you're piggybacking on everything there. We also, one of the hacks that we recommend for our families that we love them because they're so crunchy to begin with, that label
Yeah,
crunchy,
I love it.
we give them a discount code to purchase their own home ozone generators because our treatment for ear respiratory infections is ear ozone, nasal ozonides, IV ozone for COVID with IV therapy. And we do that for our vector-borne illness for people who can't take antimicrobials. We nebulize a lot of biocidin and do a lot of biocidin in the mouth. And so I love hearing that. Yeah, our kids, and we ask them about their poop every time they roll through the door.
Absolutely. That's my
They,
favorite topic, Paula.
yeah, we got our little Bristol stool chart, and the kids go,
Yeah, suitable
yeah,
for
I'm,
framing. I tell people all the time,
yeah, I'm a type 4. Yay,
oh,
perfect
yeah,
poopy.
yeah.
Yeah,
If there was a poop Olympics, we could
oh,
all
I love that.
compete.
Yeah, it's like poop is what I do, but the kids have it. I even had a mom say, Dr. K, you need to tell Luke to wear his shoes. And he said, but Dr. K said I had to ground.
Oh, that is, and see those free things that people can do. That's one thing we talked about when we met. That's the key. If people can feel empowered with things that are just by design that people have done ancestrally. And I want to go back to the manual therapy. We have lots of good manual therapists here in the Oklahoma City area. And so, in fact, our little granddaughter has the manual therapy, and it's just helped her breastfeed more easily because, just simple things. She didn't feel it. She was happy, and it's just incredible. Manual therapy is new to me in the last like 10 or 15 years. So, quite an amazing thing. I probably need to find a manual therapist to interview because it's hugely helpful for people and non-invasive and not super expensive.
Yeah, I can see the name of a really good one here. A lot of our patients have hypermobility because they may have like concurrent Bartonellosis or they have a lot of
Which is a
cranios.
tick-borne disease for our listeners. Yeah.
Yes,
Lyme disease.
yes. And there is Lyme disease in Texas. All four of my children have had, my kids are now 18 to 30. And I'm a grandparent too, and I'm an empty nester, but soon to be another grandma. Um, you do not have to have, and in fact, it may do more harm than good, a rapid velocity manual adjustment versus gentle
Right.
body manipulation. And so this body work and how it is so empowering. And I remember that years ago, before I was ever functionally minded at all, I was seeing a chiropractor's children, and I went in to see him after I gave birth to my third child because I had 2 C-sections. Then I was blessed to have 2 vaginal births
Mm,
after
that's unusual.
cesareans. Yeah, 2 VBACs. I was able to slide it through, but my sacroiliac joint was out of place. So being the allopathic, traditionally trained doctor, I went to the orthopedist who looked and, oh, your spine is okay, but didn't look at my SI joint. And also, I had 2 massive kidney stones if they'd gone out a little further, to see the calcifications. But I went and saw him, and he said, you're the last person I thought I'd see on my table. By just a little bit of manipulation, he popped my SI joint back in, and it was like the pain was gone immediately. And I'm like, people don't understand that their insurance may cover that. Like, we don't take insurance, but we give people super bills, and we do all the coding. We try to run we do ICD-10 codes. We run all their labs through their insurance, and we also offer less than non-insured cash prices, etc. But you can move the needle, like you said, free. It's the power of the kitchen. Clean your water, clean your air, ground, get into nature. We spend so much time indoors. And if your indoor environment is toxic, you're going to be toxic. And you really can't get enough vitamin D by being outside unless you don't have any genetic vulnerabilities. And
I told an 88-year-old couple yesterday they needed to get out naked at noon. And, they were pretty excited about that, actually. They said, we got to build a fence. So, we talked about that. But, I think the overriding thing that's so great about what you said is that we don't want to accept normal as our standard. And I love to joke about normal in our current world. It's what's typical, and it is, dehydrated, irritated, constipated, frustrated, overscheduled, overstimulated, underrested, undernourished, and totally stressed out. And we're accepting normal as the standard. So no, folks, we can live with vitality. We can live with energy. We can have this long and vibrant health span, and maybe, one sick day before we go to glory. I mean, you don't have to have this long, 2 or 3 decades of going to doctors all the time. And you're getting people started early, Dr. Paula, early. So I really appreciate your time. This has been so fun. I loved hearing your story. I didn't know you'd had a gastric bypass. It's amazing how things that happen to us pull us into this world of empowerment and curiosity and new knowledge. I'm learning every single day, and it's just so much fun. How can people find you, find your expertise, your resources? Tell us about that.
Well, thank you. I just want to thank you for creating this podcast and making awareness known to folks and allowing me to be on there. I don't have to hide in the shadows anymore. I'm so grateful that RSK is in place to make America healthy again, or at least give people some other tips, and so that we can start breaking the norm. You're so right. If we go the way of culture and it's like, nope, this is not normal, this isn't normal, we need to break that and be present. So our website is gettotheroot.com. It's GET, the number 2, theroot.com. And we offer free discovery or welcome calls. And because the key to changing your trajectory is behavioral modification, we partner with health coaches. And so we ask that you partner with a coach, and they're the ones who do the welcome calls, and they're free. So people come to us from actually all over the world. I spoke to someone in Italy yesterday, but in order to be a medical patient, they have to come to us in Texas at least once a year. And then if you're a Florida resident, I'm the only one of our 7 medical providers that does in Florida. But gettotheroot.com, make a free welcome or discovery call. And then we have Instagram, Facebook, Twitter, but we also have all the conditions we cover. I've studied extensively with Dr. Richie Shoemaker. I had that. That's what I have. And you can be vibrant and brilliant and be part of 25% of the population without vulnerability, but you don't have to live there. So we treat children and adults with that. We are also members of the International Lyme and Associated Diseases Society. So we're Lyme literate, Bartonella babesia, which is vector-borne illness literate. And at this time, I'm just taking medically complex children, but all of our providers understand the impact of nutrigenomics and our wellness blueprint, but that's our foundation. So that's where folks can find us. And I am so grateful for the opportunity, Debbie. Thank you.
Well, I'm so grateful for you.
There's a study that Dr. Shoemaker brought to the world called the Genie, and it's called Gene Expression, something else, I can't remember. It's a transcriptomic and proteomic test. And it looks at the proteins from 177 different genes. And when we do that test in chronic inflammatory response, it gives us very guided information to help someone recover from chronic inflammatory response and move into remission and be equipped. So we practice the Shoemaker protocol within the parameters that he's published. And, that's the way to get into remission. So anyway, and it's possible to give people hope. So when I said that, there's not a label for that. I'm just saying that we do what he says has taught, because there's evidence and publications behind it to help restore people. So that's what I meant by that. So I'll qualify that.
No, that's great. That's great, because not that many people know about chronic inflammatory response syndrome. I mean, and so they would probably get blown off somewhere else. So I want people to know that you would treat that. So thank you so much, and thank you, listeners. We're now in 140 countries, and I think a little over 5,500 cities, and that's because you are sharing this podcast. Please subscribe. Please send it to somebody that it will help. We all love children. We want our children to be strong and vibrant. We want them to get to fulfill their dreams and hopes and God-given purposes. And we want them to grow up and be arrows that, that leave our quiver. So to do that, they have to be feeling good. And just join me on Instagram. We'll put all this in the show notes for Dr. Paula Kruppstadt. And blessings until next time.
Thanks for joining us on Vitality Made Simple podcast. Be sure to visit drdebbieozment.com for our courses and resources designed to help you feel better, look better, and enjoy better relationships. Please remember to like, subscribe, and share. Thanks for joining us.